Hello there, my name's Heather Knox and I'm the Interim Chief Executive here in NHS Lanarkshire. I'm leading our recovery from COVID and taking forward a number of services that are remobilising following the pandemic. I'm really pleased to let you know that following the recovery group this morning, we have a range of acute services coming back online, but also importantly our chronic pain service is being re-established, and we're also re-establishing a service for vulnerable groups that are hard to reach in the community. I think you'll agree those are both very important services to get back in place. As I said to you last week, myself and the Chair, Nina Mahal, were planning to go out and visit some of the sites, and we went out last week to Hairmyres Hospital first of all, where we met Ray Ryan in the outpatients department, and she spent a bit of time with us, so thank you Ray, talking through the issues that face her in terms of remobilisation in the outpatient department. One of the things she shared with us was the issue of space in the waiting area, and I've raised that issue with the Scottish Government colleagues to see if we can look at that again, because clearly if patients have got masks on, then maybe we can look at changing the safe distance from possibly 2 metres back to 1. So I've suggested that might be something for them to consider, and they're actively considering that, so I hope to have some news on that soon. We then went to visit the CCU and met with Anne-Marie Johnston in CCU, and she talked us through how they needed to change the role and function of the unit into HDU during the pandemic, and the challenges that brought for her and her staff, who I have to say have just risen to the challenge and worked really flexibly during that period of time. She was hugely complimentary about all of her staff, as was Ray. I think so many staff have moved out of their comfort zones and gone into new roles, and their flexibility, their commitment, their professionalism just shines through when you visit these places. So thank you to staff at Hairmyres. We then also went to Wishaw and met with staff on the Wishaw site. We went to Ward 15, which is the orthopaedic ward, and I met with Lorna Marshall, Sharon Smith and David Howie, and we talked about the issues around centralising trauma services during the pandemic at Wishaw and the challenges that had brought for the staff. Again, huge professionalism and commitment, and just a joy to see the team working so well together, and they've had to do it at such a pace, so really welcome all the hard work that's gone into making that work for NHS Lanarkshire. We then also went to wards 7 and 8 and talked to Veronica Fearon and Jennifer Spence about the challenges they had faced in mobilising services around COVID with their teams as well. And again, just a fantastic response from all the staff involved in that team there. So I just want to end today by saying again, thank you to all of you for everything you do every day for our patients in Lanarkshire. Thank you.